Hi, I'm Sarika Ramanathan. This is my mother, Dr. Sujana, and she got some questions on Instagram, and I'm going to ask them to her. She's going to answer them. Okay. So the first question is, what is COVID-19?
COVID-19 is a virus disease that's spread around the world right now. COVID stands for coronavirus disease, and the 19 means that it was first reported on December 31st, 2019. It's a coronavirus disease, and a coronavirus, corona means crown, so the virus's shape is a ball with little viral bits on it that looks sort of like a crown. So that's why it's called a coronavirus.
And the next question is, how contagious is it?
So coronavirus, this particular coronavirus, COVID-19, seems to be very contagious. And you can transmit it before you even know that you have it or you're carrying it. And that's why we're all concerned about physical distancing and masks and washing your hands, because you can be carrying COVID in your body and actually exhaling it through your breath without you realizing that you have it. Luckily, over 80% of coronavirus cases are either very mild, super mild, or mild. And only 20% are really bad. Unfortunately, that 20% can be really bad, including needing hospitalization or intubation to help you breathe, and in fact, leading to death. As of now, which is Memorial Day weekend 2020, in the United States, we have over 97,000 Americans who have died from coronavirus disease, from this particular COVID-19 coronavirus disease.
The next question is, what symptoms should we be looking for?
It's a good question. A lot of times there's no symptoms at all, or you maybe had a little bit of a cough or felt a little sick and then it passed. A lot of people are telling us that. The other symptoms that you should look for are a persistent cough, fever, and fever is defined as over 100.4 degrees Fahrenheit. You should look for a sudden loss of smell or taste that's not related to, let's say, your allergies or nasal congestion, but you suddenly can't smell. And that's seen in a high percentage of people with coronavirus or COVID-19 infection. There are other things that we are looking for: trouble breathing. A lot of people with worse disease report that their lungs feel like they're on fire, they have all this pressure. There are some very strange skin elements that we're looking for, like it looks like you've been bruised on your fingers or your toes when you haven't been. Unfortunately, you can have clotting that affects your brain or other parts of your body. So the symptoms go from very mild to very intense. Some of the symptoms can just be some diarrhea for a day or two that you may even just pass off. And if you're otherwise healthy, maybe that's okay, but you can get worse from that.
Now, the next set of questions is about masks. And the first one is, what is the bottom line?
So the bottom line is a mask, any mask of any kind, whether it's a bandana, a cloth mask, a surgical mask, or an N95 respirator mask, any mask will dramatically reduce the possibility that if you are harboring COVID-19 virus in your body, that you will spread it to other people. So the bottom line is, the best way to keep this disease from overwhelming our population is to wear some sort of mask.
Okay, and then the next question is, if I'm outside and 6 feet away from my friends, do I need a mask?
The short answer is yes. And the long answer is, imagine we're about a foot and a half from each other. Imagine that you're with 3 or 4 friends. Each of you has to be 6 feet from each other. So it's a huge circle radius that has these 4 points. What are the chances that you're going to be talking and laughing and doing stuff and not inch closer together, right? So even if you're outside, even if you are doing your best to maintain your distance, wearing a mask really protects yourself, it really protects the other person, and it actually protects the other person's family members who aren't even hanging out with you, because if they don't catch the disease from you, they can't go home and give it to their family members. So even if you're outside, even if you think you're maintaining your distance, wear a mask.
Okay. And then there's, how many times can a disposable mask be reused?
So we never used to reuse disposable masks, right? I mean, I'm a surgeon. I wear a mask, I throw it out. In fact, it was a rule that you didn't even wear it like loose around your neck like you see on the TV shows in between patients. You threw it out and then you picked up another mask for the next patient. Because we have this overwhelming use and need for masks now, we are reusing masks all the time. So if you air out your mask properly, so you can hang it up somewhere where it just kind of air dries overnight, you can keep reusing it until or unless it becomes wet or soiled. Once it's wet or soiled, you have to throw it out and get another one.
Are 2 disposable masks worn at the same time better than 1?
That's a really clever question. Probably not. Probably not. You'll find that when you go to your doctor, and it's a good time to go to your doctor for regular checkups and vaccinations and regular care, because we really want to prevent you from getting sicker. So we want to help you by treating you in the office. You will find that your doctor is usually wearing an N95 mask or a tighter fitting mask and then a surgical mask over it. And the reason we're doing that is that the N95s are even harder to get than the surgical masks. So we are reusing the N95s for as long as possible and using the surgical mask over it. So in case our patient coughs, or maybe there's some blood or some liquid or something that affects our surgical mask, we can throw that away and cover a new surgical mask and keep reusing the N95s. In terms of protection between 1 or 2 surgical masks, not really, and it's hard enough to breathe for most people with 1 surgical mask on. It just makes it a little harder to breathe still.
Okay, and then the final question is, how accurate is taking someone's temperature when most people may not have one?
So a lot of times when you go to the doctor for your routine checkup, they'll ask you some questions at the front door and they'll take your temperature. And often people are checking their own temperature 1 to 2 times a day, and really they shouldn't be checking it more often than that. And the magic number is 100.4. So the CDC, which is the Centers for Disease Control in the United States, has told us that if your temperature is over 100.4, talk to your doctor. That may be an early sign that you have COVID infection. A lot of people are checked. You know, my office checks everybody. We're not finding a lot of people with fevers, but we are finding the occasional person with fever. So that's worthwhile. Checking your oxygenation with a pulse oximeter, which is that little thing you put on your finger. Looking for a normal pulse oxygenation in a healthy person at room air is about 99, 98, 100. The ones you can get at home are not as accurate as the ones in the hospital, so we'll even tolerate like 95, 94, 93. But if your pulse oxygenation is consistent, was high and is now low, so below 93, 92, 90, you need to call your doctor. I wanted to talk a little bit more about masks because people are very concerned. Everyone's out and about, the weather's getting better. This is a really nice graphic. So this graphic shows that if this person is COVID positive and doesn't know it, and they're talking to this person at about the distance you and I are, and they're not wearing a mask, it's really high that this person will give it to that person. So Goofus will give it to Gallant, let's say. If this person is contagious, but this guy is wearing a mask, it's still a high likelihood that Goofus will give it to Gallant, because the plume of the virus, like a cough or a laugh or a sneeze, is going to project that virus particle further. This guy's eyes are not covered, his mask may not be snug over his nose or his mouth, and he may still get disease. If this guy is wearing a mask and coughing or breathing or talking and has COVID and is the same distance away from the uninfected guy, this is a medium risk. So he has really lessened from very high to medium the risk that he's going to give this person disease. If this guy's wearing a mask and this guy's wearing a mask, even if this guy is contagious, it's a low risk of getting the disease. Now, if they both wear masks, this guy is still contagious, but now instead of hanging out right next to each other, they are 6 feet or more apart. This becomes a very low risk. And obviously, if this guy's in the street, mask or not, and this other guy's at home, the chance of him giving that disease to him is 0. So if you look at this, even when you were saying, if I stay 6 feet apart from my friends, blah, blah, if you're both wearing masks, you're going to make each other safer, and you're going to make the people in your family safer. If you happen to live with your parents who are over 50, if you happen to live with your grandparents, if you happen to have a small baby or younger siblings in the house, you are protecting everybody by taking the very small step of wearing a mask when you're outside with your friends. Thank you guys for listening. Thank you to my daughter Sarika for moderating this session. Stay safe and stay healthy.